Hello everyone, welcome to this video. Welcome to Shofu 10 minutes cases with me, Dr. Daniel Kenji. First of all, I would like to introduce myself. My name is Dr. Daniel Kenji Funabashi. I am a DDS, postgraduated in operative dentistry, focused in aesthetic dentistry using composites and ceramics. I hold a master and a doctorate in dental materials, and today I would talk to you about how I restore class 1 cavities, medium and large cavities, and cover the layering technique that I use in office. So when we have a carie decay, we must do all the clinical exams to evaluate the tissue lesion. Characteristics as extension and depth are crucial to define the restorative approach that we have to follow. So in this particular case, a composite restoration was strongly indicated. I like to remove the weakened enamel using a high-speed handpiece with a diamond burr, and to remove the infected dentin, a low-speed handpiece and a carbide burr. In both situations, I recommend you to use abundant irrigation with water. This abundant irrigation will avoid the heating and also prevent post-operative sensitivity. That's very, very important. After the infected tissue removal, we need to apply the adhesive. In most of the cases, I like to use a self-etch adhesive or a universal adhesive in self-etch mode. I don't etch dentin. So for this situation, I use the BeautiBond Xtreme. The BeautiBond Xtreme is a universal adhesive, and as a universal adhesive, it can be used in both modes, etch rings and self-etching. Because I want to use it as a self-etching adhesive, I must etch the surrounding enamel with a phosphoric acid for 30 seconds, rinse for another 30 seconds, and dry. After that, I can make an active application of the adhesive, rubbing the microbrush on the dentin surface to enhance the penetration of the material. After that, I like to apply a gentle air steam to volatilize the adhesive solvent. And this step is very crucial because only after the volatilization of the solvents, I should light cure the adhesive layer. So my bonding is finished now, and over this bonding layer, I usually apply an resinous material containing fillers, in other words, a flowable composite. And Shofu have the Beautifil flow plus a flowable composite that is presented in two opacities. So I like to take advantage of the high opacity shades to cover any discoloration of the dentin. The Beautifil Flow Plus is also presented in two different viscosities. So you can have a high viscosity flowable material and also a low viscosity flowable material. That's very, very interesting. Also, this additional layer of this resinous material, this flowable material, will reinforce the adhesive layer and even out the cavity's bottom surface. So we can start our layering technique, avoiding any bubbles or voids between our first increment and the adhesive layer. After curing the flowable composite, my very first composite layer for posterior restorations is the Beautifil Bulk Restorative. I really recommend you to try the A shade. The A stands for amber, and this particular shade, the A shade, presents the desirable and well-known blending effect. In other words, this composite can adapt itself to the shade of the cavity, to the surrounding tissue. So you can use it in many situations in different shades. The Beautifil Bulk Restorative is also a bulk fill composite So we can light cure 4 millimeters thickness increments. I will insert the material and leave for the next layer at 2 millimeters of thickness. So after check this with this burnisher, I can light cure the Beautifil bulk restorative layer. And for my final layer, I recommend you to use the Beautifil 2LS. The enamel shades presents medium opacity that provides a very natural look to the restoration. This composite have a nice polishing gloss, mimicking the tooth enamel. I usually insert the material, the composite using this burnisher, this ball burnisher, to adapt the material to all the cavity walls and fill the 2 millimeters thickness that I left in the previous layer. And then I will use this another instrument to measure the amount of composite and remove the excess. So I use the enamel angles of the cusps to help me and guide the angulation of this instrument. And I will do it using the facial and the lingual cusps. In the end of this process, I will have this. So now I'm ready to make what I call sulcus functional division. I will divide the composite with occlusal lines that will guide the morphology. Now I can light cure my final layer. We can finish the restorative procedure here and begin the polishing using polishers like Shofu OneGloss PS polishers. These rubber polishers will create a low roughness and a high gloss uh, to the surface of the material, providing a smooth surface. For posterior restorations, where we need to polish the occlusal, I recommend the flame-shaped polishers. They present a better adaptation to the tooth morphology. However, I like to use this moment to apply stainings and pigments to the restoration. Pigments like orange, ochre, and brown can produce a very natural staining in the restoration when well used. And Shofu have the light art pigments, so we can have these pigments and apply in certain points, in certain parts of the restoration to mimic the natural staining of the tooth. And that is the restoration after this step. As we can see, the sulcus now is more evident, enhancing the morphology and the perception of the morphology of the tooth. So I hope that you have enjoyed this presentation, this short lecture. Thank you for your attention. I would like to see you in the next 10 minutes cases from Shofu. Best wishes for you, and remember, master a new skill requires time and practice. So have a nice day.